Okay, welcome everyone to the February
Bueno, bienvenidos a todos
Western Center for Agricultural
a
Health
la
seminar. Please go ahead and advance the slide. I'm going to go ahead and get us started with some housekeeping items. First, I'd like to let you know that the seminar is being recorded and all participants are muted. I'd also like you to know that the chat function is available for you to submit questions, and we will have a question and answer session at the end of the presentation. So please submit your questions, and know we'll have about 10 minutes at the end for you to pose questions for the speakers. I think we're going to have a great discussion and a lot of really fruitful conversation. We also have Spanish interpretation available. So please choose the language you would like to listen to using the globe icon at the bottom of your screen. You can choose either English or Spanish. We also have closed captioning available, and so you can select the CC icon below and click Show Subtitle. I'm really thrilled to be able to introduce our speakers today. Dr. Rosa Manzo from the University of California, Merced, and Nancy Villasenor from the Office of Environmental Health Hazard Assessment with the state of California are going to talk about health practices among farm worker communities in Madera. It's from a funded project with the Western Center for Agricultural Health and Safety. And I'm going to go ahead and turn it over to them to lead our conversation. We're really thrilled to have you here today. Nancy, actually, no, Dr. Manzo, I'm going to turn it over to you. Thank you.
Thank you, Heather, and thank you everyone for joining us. It's a great pleasure to be here today to discuss our pilot study titled The Health Practices Among Farm Worker Communities in California. As Heather mentioned, we conducted a pilot study in Madera County. And next slide, please, Nancy. And our study is a collaboration between the Office of Environmental Health Hazard and Assessment and UC Merced with the funding from the Western Center for Agricultural Health and Safety Small Grants Program from UC Davis. So thank you for the support. The project goals for our study, we aim to assess the health practices among farm worker communities in Madera County to better understand and tailor health education efforts. We wanted to focus specifically on pesticide exposure and pesticide-related illnesses. So really looking at what were those practices among farm workers who were exposed to pesticide and also had experienced pesticide-related illness. So how did we start this collaboration? This collaboration started actually back during COVID. The Office of Environmental Health Hazard and Assessment, we were in several conversations about the reporting of pesticide-related illnesses. And through those early interactions, we heard anecdotes from various stakeholders, including physicians, community health workers, who shared with us that many agricultural workers do not go to conventional health professionals, but rather visit traditional healers and use home remedies. And some of the reasons why they may not seek conventional health include financial, legal status, trust within the healthcare, cultural, language barriers. So we asked ourselves, if we were to provide training to the right audience, do agricultural workers seek care from conventional health professionals when experiencing pesticide-related symptoms? And if not, who else can we go to? So within California, as we know, one of the largest producers of agricultural products within the nation, we thought we would be able to find this information in the literature. However, it turns out our question had not been asked within existing California studies. But there was a researcher in Northern Carolina who has been working on the issue for a while, Dr. Thomas Arkery, and we contacted him, and he shared with us lessons learned from one of his studies and also told us we could adapt the International Complementary and Alternative Medicine Questionnaire. to elicit use of conventional healthcare providers, traditional healers, and complementary therapies in agricultural communities. His work focused on the Latina community, and so we used that questionnaire to adapt it to the community in Madera County. So our process, as I mentioned, was the Office of Environmental Health Hazard and Assessment and UC Merced had previously collaborated, and we had been in several conversations. I have an existing collaboration with Camarena Health out of Madera County. So this project was really built on former collaborations between UC Merced, the Office of Environmental Health Hazard and Assessment, and Camarena Health. We received the funding from the Western Center and the small grant program, which require us to perform the study within a short period, only 8 months. So we decided to limit the study to only one county, Madera County. And through our previous existing partnership with the promotoras out of Camarena Health, we were able to work on this project in such a short time. We also had an existing IRB approval from UC Merced through our previous collaboration with Camarena Health, and we were able to modify that IRB to quickly engage in the research activities. Next slide, please. So thanks to our existing connections, we contracted the community health workers out of Camarena Health, and they have been trained by our UC Merced team on how to conduct surveys, as well as adapting surveys and collecting data from the community. So the community health workers helped us to adapt the survey to Spanish and also make it linguistically appropriate for the population in Madera County. Some of their suggestions included language, reformulating questions, or even suggesting questions based on their observations of public health issues in the Central Valley, such as valley fever and children's health. We also hired 5 students from UC Davis Graduate Program of Environmental Policy and Management who helped us identify languages and dialects spoken by farm workers in areas of high pesticide use, including Madera County. So thanks to the work that the UC Davis students conducted in their research, we learned that most of the farm workers in Madera County are of Mexican origin and speak Spanish, but also there was dialects including Mixteco, Zapoteco, and Triqui as most Mexican indigenous languages, where these 3 indigenous languages are only verbal dialects, as some of us may already know. Our study included 125 participants, and most of the community health workers from Camarena Health only spoke Spanish. There was 2 of the community health workers who speak Zapoteco. So to include the Mixteco and Triqui dialects, we contracted with the nonprofit organization Centro Binacional para el Desarrollo Indígena Oaxaqueño to conduct those surveys. We also aim to keep the surveys demographically representative of farm workers in Madera County. So the community health workers conducted 50 surveys in Spanish, 25 in Mixteco, 25 in Zapoteco, and 25 in Triqui. We asked the community health workers to conduct these surveys where farm workers live and work, such as agricultural fields, the homes, the church, and the stores. We specifically instructed them not to recruit or collect data from the health center. Surveys were also conducted in the indigenous dialects, but those took twice as long to conduct. The survey would ask the questions in the indigenous dialect, which is only a verbal language, and would write the answers in Spanish. So what are some of the things that we found? So first of all, focusing on the population descriptors, including age, gender, educational level, knowledge of Spanish and English, their living situation, we learned that the majority of the participants, 47%, fell within the age range of 35 and 50 years old, as you can see here. In terms of gender, we see almost an equal distribution with 51% male and 49% female. We also wanted to learn more about their educational level. So we asked the question, what is the highest level of education or grade level you have completed? So as you see here, the median is slightly higher than the 5th grade level. We also asked participants if they knew how to read and write in Spanish and English. Most did not consider themselves literate in Spanish and even less in English. Some who spoke indigenous dialects said they understood a little bit of Spanish. Interestingly, 8% of those who speak Triqui did not know if they were literal in Spanish. Similarly, 50% of those who speak Spanish did not know if they were literate in English. And so did 32% of those that speak Mixteco and 32% of those that speak Triqui. In terms of their living situation, the vast majority of study participants live with other family members. We wanted to know if there was a potential for take-home exposure. So this was an important finding for us. We also found that 70% of the study participants live with their partner and 66% have minors in the household. We also asked the participants to self-assess their health status, and overall they consider their health to be in good or regular standing, about 84% of those. Only 6% indicated their health status was bad and 10% were not sure. Of the total participants, 7% reported suffering from arthritis, 14% from diabetes, 2% from heart conditions, 15% from hypertension, 2% from asthma, and 14% from allergies. So now I'm going to hand it over to my co-investigator, Nancy Villasenor, to continue with the rest of the presentation.
I hope I can only see my notes. Am I the only one? Okay. Well, we wanted to assess if farm workers have been exposed to pesticides. So we asked them if they were using pesticides at work. And 26% of them told us that they applied pesticides at work in the past 12 months. And of those, 73% were using personal protective equipment when doing so, mostly provided by the employer or the supervisor. Of those that did apply pesticides, we asked if they were trained on the proper use of pesticide application, and 59% said they were, which is a requirement under the environmental protection, worker protection standards for pesticide handlers. Only 64% were using or were trained in the proper use of personal protective equipment. Also, this training was provided by their supervisor or their employers. We wanted to know if they had ever been exposed to pesticides at work, even if they were not handling pesticides. And although only a quarter of the participants said they applied pesticides at work, 2/3 of participants indicated they had been exposed to pesticides in the workplace. And we then asked them, what do you do after realizing you have been exposed to pesticides? And about half said they washed their hands. Few said they showered. fewer washed their clothes, and only 8%, very few, said that they told their employer about that exposure. We also wanted to assess if they were being exposed to pesticides at home. And 84% told us that they applied pesticides at home, although only a few times per year, mostly to treat insects and spiders. And not many farm workers would know what the symptoms of pesticide-related poisonings are. Symptoms can feel very similar to the symptoms of other conditions like the flu or heat-related illnesses. So in the survey, we listed the symptoms of pesticide poisoning and asked them if they had experienced any of the symptoms within the past 12 months, without letting them know that that was pesticide poisoning. And just for reference, I'm going to show you this slide that has the symptoms due to acute pesticide poisoning. They can go from mild to severe and affect all parts of the body. A person that has been poisoned with pesticides can experience any of them. And as you see, it'll be easy to see why some of the symptoms may be confused for other illnesses or just as consequences of working in a very physical job as is agricultural work in very high temperatures like those that can reach the Central Valley or Madera. Symptoms go from a rash to loss of consciousness and sometimes very quickly. So when asked about the symptoms, we learned that 83% had suffered from one or more pesticide-related symptoms. The majority had experienced two or more. Of the ones that did experience symptoms, 73% experienced them either at work or soon after. And some of the most common symptoms they experienced included eye irritation, vision problems, headaches, nausea, vomiting, salivation or watery eyes, numbness, and emotional problems such as anxiety, stress, sleep issues, and depression. And we did not do a medical evaluation, so these symptoms may be related to other illnesses and not necessarily caused by pesticides, but as you saw in that slide with the symptoms of pesticide poisoning, they do relate. The community health workers from Camarena Hospital who helped us to design the survey recommended us that we include questions about pregnancy and children's health. And although we were not able to establish a direct link between the participants' exposure to pesticides, some of the health effects that they reported are included in the list of well-known long-term effects of pesticides. But unfortunately, we didn't capture enough information with this survey, so more research needs to be done. But 7 of the 10 women who had been pregnant had problems during pregnancy. Problems such as miscarriages, bleeding, tiredness, and low blood pressure. And 10 of the 82 participants, men and women who had children, reported their children had asthma. 5 of the children had learning disorders such as autism, attention deficit disorder, and hyperactivity. And because our mandate is to provide education to healthcare providers on the proper diagnosis, treatment, and reporting of pesticide-related illnesses, with this study, as Dr. Manzo mentioned, we wanted to find out where do farm workers go to seek care when they are experiencing pesticide-related symptoms? Do they seek care from conventional healthcare providers? Or as we had heard anecdotally from our stakeholders, they visit traditional healers. And what we found is that 64 indicated that they had consulted with some type of healthcare provider to help with pesticide-related symptoms. Of those 64, 53 sought conventional care, like clinicians, a nurse, or a physician. And 30% sought traditional care. That 30%, 20% said they would go to seek a sobador, which is a mixture of a masseuse and a chiropractor. And 4% consulted with curandero, a traditional healer. 55% of those that sought care consulted with somebody in California, 20% with a provider outside of California, and 26% said they did not remember where. About 26% of those that sought conventional care said they also visited a traditional healer. And just as the name of the survey that we use suggested, we also wanted to know about home remedies and self-care practices. And as you see here, participants engage in a wide range of medicinal and self-help practices that range from you drinking teas or using lemon, medicinal herbs and garlic, praying, taking vitamins, and 26% did mention that they use antibiotics without prescription. We asked participants how they keep informed about topics of their interest so that we know how to distribute future education and outreach. And they mentioned their preferred method or preferred form of communication is obtaining via television, 60%, followed by through friends and family members, and half of them through social media like Facebook. Similarly, we asked them how they would prefer to receive pesticide-related information or education. And their preferred method for learning about these would be through short videos, the majority of them, followed by radio, and through workshops and community events. And only 26% mentioned in written forms, such as through brochures and flyers. So in conclusion, we found there is a need for developing culturally and linguistically appropriate education. We found that the average education level of farm workers in Madera is a 5th grade. And as Dr. Manzo shared before, they indicated having low literacy in both English and Spanish, with many speaking Mexican indigenous languages that are only verbal. We also find there is a need to consider their communication and education preferences. Most of the participating farm workers are exposed to pesticides, even when few of them apply pesticides as part of their job. As we found, they are also applying pesticides at home. They have experienced symptoms that might be pesticide related while at work or soon after. So there is a need for educating these communities on pesticide exposure prevention and pesticide related illnesses. We also find a need for continue to educate conventional clinicians and also to provide education to traditional healthcare providers, because they are seeking care from both. We will continue educating clinicians on how to properly diagnose, treat, and report pesticide illnesses, but we also see a need to increase awareness among traditional healers and other healthcare professionals such as community health workers or promotoras de salud. Some of the limitations of our study include missing information. Our intent was to keep the survey as short as possible. But as we gathered the data, we realized that we could have benefited from asking more questions. For example, asking participants if they thought their symptoms were related to pesticides. And then when they went to seek help for treating those symptoms, did they mention to their providers that they had handled or work around pesticides? There were some biases to our study too. Not all those that conducted the surveys were involved in its design. So we don't know if that played a role. For example, the community health workers from Camarena Health, who were involved in the design of the survey and conducted the surveys in Spanish and Zapoteco, versus those that conducted the surveys from Centro Binacional Oaxaqueño, who were not involved, and conducted them in Triqui and Mixteco. Some of our future steps include to continue to analyze the data, mainly to look at the differences in the languages spoken. We also want to improve the survey for future studies to include the lessons that we learned through this project. And create culturally and linguistically appropriate educational material to educate health professionals and their patients on pesticide issues. And we want to conduct more studies in other communities in California, in other languages, and in other counties. And just to finalize, and I'll stop sharing, I just wanted to thank the University of Davis for funding this study, especially the Western Center for Agricultural Health and Safety. I want to thank the community health workers from Camarena and Centro Binacional Oaxaqueño and their staff for helping us with this. And I want to acknowledge the UC Merced Farm Worker Health Study for their effort to provide a more comprehensive picture of farm worker health. And I'll turn it over to you, Heather.
Wonderful. Thank you so much. I'm just really excited for this work and all that it offers in our understanding about the experiences of farm workers related to pesticide exposure and their experiences handling the symptoms that they experience after work and in their communities. And thank you for mentioning the UC Merced Farm Worker Health Study that just launched on Friday. It provides a wealth of information about the experiences of farm workers. It's a new study that was released and fills a gap of 20 years that I encourage everyone to read, and we will have a lot of time to digest the findings, and I hope to have Dr. Flores and Dr. Padilla speak to all of us in a future setting. So we have already received a lot of questions for you, Dr. Manzo and Nancy, and so I'm gonna jump in and encourage everyone in the audience to continue asking questions and put them in the chat. So let's see. One that's jumping out, just sort of a methodological question. I'll start there. Why you mentioned that surveys were done in community settings, grocery stores, churches, fields, homes, but not in clinic settings. And so maybe you can just briefly explain that decision.
Our primary intention for doing that was that we did not want to bias our results. We had heard anecdotally that a lot of them were not seeking conventional care in the clinics. So we wanted to have a good idea of where farm workers were seeking care. So we know they're working in the agricultural fields, out in the community, attending church and other community events. So we instructed the community health workers to avoid the clinics for that reason, so that we can have a better understanding of that.
Great, thank you. Okay, so lots of good questions about the kind of exposures that farm workers may have had. Do you know whether or not any of the providers seen by, and I guess this would be probably the farm workers who did go to clinics, do you know whether any of the providers reported cases of suspected pesticide poisoning?
We did not ask that question. That would have been an excellent one, but they are mandated to report. Of course, if they know that that is a pesticide related illness, then many physicians are not trained on that. And as I mentioned, not only for a farm worker, but also for clinicians, it is difficult to not diagnose because the symptoms can look like the symptoms of other conditions.
And if I may add a little bit here, our initial collaboration with the Office of Environmental Health and Hazard Assessment started for that reason, that there was underreporting of pesticide-related illnesses. And so we wanted to understand that issue. And we started speaking with clinicians, healthcare providers, and a lot of them did not know the mechanism of how to report to the state even. So that led to some of the understanding that led to this study as well.
So has that resulted, I mean, it seems like there's a lot of opportunity coming out of this study for education. And it seems like it's on the education for farm workers. As a health and safety center, I think that we do education for farm workers, for community organizations and leaders, as well as for supervisors and growers. And so it seemed like, it seems like there's a great opportunity there. And then also I'm hearing an opportunity for education of clinicians and providers. Have you started that process and starting to identify ways in which providers can be educated on the symptoms and the mechanisms for reporting those exposures? Or is that a future avenue?
No, we have started. As a matter of fact, our section, the pesticide epidemiology section, has a mandate to train healthcare providers. And we have a public health medical officers who trains clinicians on the proper diagnosis, treatment, and reporting of pesticide illnesses. And as recently as of last year, we also extended the education to non-healthcare professionals such as administrators, health educators, patient navigators, and also community health workers in both English and Spanish.
That's great. Okay, let's see. I'm going to go back to a question, some more questions from the audience. So another specific one that you may not have been able to get to in the survey that you currently use, but do you know whether or not the exposures were the type of pesticide that farm workers may have been exposed to, whether it was Roundup or organophosphates or any of the specific type of pesticides that they may have been exposed to?
We did not collect that information, unfortunately.
Okay. What about the activities that the farm workers may have been engaged in while they were working? Did you ask about the type of activities they were engaged in during work, whether they were harvesting, whether you talked about some of them being applicators, but do you know what they were themselves doing during the workday when they were exposed?
We did not ask about the specific activities.
Yeah. Okay.
Question.
Yeah, this is all one of those, this is a pilot that leads to the potential for future avenues of research, right?
Yes.
In regards to the symptoms that we discussed during the presentation, the question was framed around during work or after work.
Okay. All right, let's see. So one of the things that jumped out at me was related to the communication, the type of communication people wanted to receive information in. So you talked about video and community events, the different ways in which people wanted to receive information. One of the things that stood out to me was that there wasn't a mention of worksite training or worksite education, even though this is very much a worksite exposure for the most part, right? And I'm curious what you think about that and whether or not that farm workers see that as a viable, or in your study, whether that was a viable place for learning about the workplace hazard.
Workshop, maybe I am just thinking that might be a linguistic difference, that workshop or taller in Spanish does mean training for many people. And so they did indicate that one of the preferences would be through workshops and or community events. So it might be there, but I don't want to make that assumption. And it might be with, but many of them, through the farm worker health study, we learned that don't receive much training, and the training that they do receive, they don't understand. So you saw that the preferences in communication were verbal, mostly through video, social media, through friends and family. So I would imagine that this also applies to that, the need to have something that is more accessible than through formal training.
Yeah. And so we just got a question about social media, and did you get a sense as to, social media means a lot of things, and what's popular changes, it sometimes feels like by the minute. Did you get a sense of what the popular platforms were among the farm workers that you spoke to?
And then now, in retrospective, we think that we should have provided an option for them to mark what if they use social media, and we only put in parentheses, and that was a suggestion of the community health workers, like Facebook, such as Facebook or Instagram. But it would have been good, and for future studies, we could do that of specifying the different options of social media, like TikTok, Snapchat, what else?
Okay, we're getting so many good questions. Okay, understanding this study was primarily through survey. Are there any considerations for conducting blood analysis for the presence of pesticides, including for potential family cohabitant contact? So this would be very much a follow-up study that would include a lot more clinical data collection.
We have not considered that.
But I know the UC Merced farm worker study did collect data collections, so it's definitely something that that's important to look into.
Absolutely. And for those of you listening and for the two of you, our call for proposals is currently open, and there might be an opportunity to look at both of your data sources side by side. Okay, based on your study, is it safe to assume that all or most farm workers in Madera County are Hispanic, or was that just the target audience?
There were very few, according to the study that, the research, I'm sorry, not the study, that the students from UC Davis helped us to conduct. There were very few who are Punjabi and some that are Hmong, but they were a minority.
And that tracks with all of the representative studies that are done, and that, yeah. Okay, I see many possible follow-up studies. Is there a correlation, for example, is there a correlation between those experiencing symptoms and use of PPE? Are the symptoms truly pesticide related, etc.? So a lot of ideas about potential follow-up studies. And are those things that the two of you, or either together or individually, are starting to explore? Are you pursuing research studies on these topics?
I don't know, Dr. Manzo.
So we've had several meetings as we were analyzing the data and looking at the results, and we're definitely coming up with different things, right? So in terms of the primary aim was to really assess the practices to learn more about what could be done on the education front. But as we continue to explore the data, we noticed there was a lot of opportunity, and it definitely builds on a lot of the work that I am doing and some of my colleagues at UC Merced. And I know, Nancy, you're also collaborating with other people across the state to look at this more broadly.
Yeah, I wanted to say that this study, thank you, Dr. Manzo, you were able to say what I wanted to say, is that the vision for these, or the purpose of these, was to let this research help us to conduct culturally and linguistically appropriate education and communication, outreach and engagement with communities that are vulnerable. And so we started this pilot study in Madera, but we're also collaborating with UC Merced, who is helping us to conduct a study among farmers, farm workers, and some of their traditional healers. We're also doing another study with the help of California State University of San Marcos to evaluate the Mixteco community in Southern California and some of their traditional healers. And the purpose of all of these is to learn about their education needs and communication preferences.
Well, and that's so important because it has to come from the community and be guided by the community. It doesn't work to start from a top-down approach. It has to be led by the community and the individuals.
Completely.
Yeah, that's fabulous. I'm glad to hear that you're doing that. With that in mind, and again, thinking about this from an occupational health and safety perspective, did you or will you think of consider what not just the communications generally, but from a training perspective, because as you mentioned, pesticide safety training is a requirement and pesticide applicator training is a requirement. Did you ask about their preferred training styles for those types of required trainings?
We did not specify if they were to receive training, how would they prefer to receive it. We did not. Yeah. We also do not provide, and I say we in my section because of our mandate, we don't provide training to farm workers.
Right.
However, we do know, and they did indicate, and because we gave them the option to say other and to mention what other would be, that they would like to receive education through community health workers. They did mention promotoras.
Yeah.
At OIHA, we are developing a train the trainer program for community health workers. It'll be in English and Spanish, and it's going to be a pilot. Community health workers training other community health workers. And we are hoping that in the future, we find a way to make this sustainable so that that information can go through to farm workers and their families.
Well, and it would be really, interesting to think about bridges between the DPR, the training that is provided to farm workers in some percentage of the cases, that is supposed to be provided to farm workers, and supplementing that, because as you said, we heard farm workers, even if they receive the training, don't always understand it. It doesn't, pesticides and the concern around pesticides and comprehension around the risk, it is one of the things that we hear from our stakeholder, from farm workers and our community partners, that is the most confusing and concerning. And having that training among promotoras and community leaders would be such an important supplement. And maybe there's actually a way of having that certification or building up that expertise and validating it in a way that it's a nice thing to imagine, that maybe there can be a different model moving forward to enhance the knowledge that farm workers could have. Okay. A question here, do you plan to train traditional healers as well? So there's the training and raising awareness around clinical practitioners and providers, but what about the traditional healers?
Yes, we plan to raise awareness among them. I don't know if training them in the same way that we train clinicians would be appropriate, since only clinicians can report pesticide-related illnesses. We for sure plan to, now that we know that farm workers and their families are visiting traditional healers, we plan to provide education and information to them too.
Okay. Kind of a question back to the demographics of the workers that you engage. Do you know anything about the size or type of farms that the workers worked on?
We did not, and our goal was to keep the survey short, and it was also a recommendation of the community health workers not to ask extensive questions. And so unfortunately, we don't have a lot of good things that we wish we did know.
Right, understood. It's a balancing act, right? The number of questions, it's like you want all the information, and yet you also recognize that people's time is valuable, and you definitely want to respect that people's privacy and need for that. So I understand. Okay, let's see. I am skimming my long list of questions here, and I want to recognize that this has been a very engaged group. We really appreciate your time for being here. Just generally, I guess, I know that you didn't collect this information, but could you give us some background on what the reporting requirements are for medical staff if there has been an acute exposure, or if there is a suspected pesticide exposure for an individual?
Even if it's just a suspicion of a pesticide, they don't have to be sure. They have to report it by law in California. Clinicians that receive a patient and they suspect it's that the symptoms or the condition is related to pesticides, they have to report it within 24 hours. They report these to the county, and the county then passes that information to the Department of, to DPR, Department of Pesticide Regulations, and then they conduct the investigations, but they have to report.
Thank you. All right. Well, I think the flow of questions. So Ann Catton, who is an amazing farm worker advocate with the CRLA Foundation, asks a question. Oh, that just disappeared off my screen. That it would be useful to follow up to ask about workplace training. And I think that, that's the kind of information that I think I probably asked the same question in a couple different ways, because I agree that's, we here at the Western Center for Ag Health and Safety one of our goals is always to create that kind of a resource, whether it's a training guide or a videos. We see our role as helping to create that kind of resource. So I echo Ann's statement that knowing what people prefer and like, it would be a great asset. So if you end up doing a follow-up survey or interviews or focus groups, and you get a sense of what people would like to hear or how they would like to hear it, that a plug for that would be fabulous. And then from Anne at DPR, she says that they are aware of comprehension being an ongoing issue for required training, and welcomes input on improving the ways in which training information can be presented to ensure comprehension. So sort of an open door, and feedback being welcomed by DPR, which is always really good to hear. And it's tricky because it's a lot of complex information that has to be communicated. And yet it has to be communicated in a way that's accessible and in the language that farm workers can understand. And I think your study shows that even in just one county, there are many languages spoken by farm workers: Triqui, Mixteco, Spanish. You didn't even, we didn't touch on Punjabi and Hmong. And that while that's hard, it's still necessary to ensure the safety of farm workers. Okay, and from Suzanne, so in addition to the Ag Center, so we have a funding opportunity that still has about 3 weeks that people can apply for. it looks like PERC also has a funding announcement that is accepting applications, and theirs is specifically for pesticide related projects. So for all of you who are on the call and doing pesticide related research, please consider applying for that. Okay, and there's a question that came in about whether we do projects related to whether we work with contractors. And I'm not sure the context of that, but in general, yes, we work with everyone in agriculture. And so we do trainings and outreach with everyone in agriculture. We research projects can involve FLCs. Basically, our goal is health and safety for anyone and everyone in agriculture. And that is inclusive of everyone. And FLCs now employ a huge segment of the farm workers. And so we want to make sure that farm labor contractors are well equipped in order to train their employees. And so we would be happy to work with any FLCs to make sure that they have the training needs that they are able to train their workers. Okay. Okay, so another question, and this is, I think, to you, Rosa and Nancy. Do you get the sense that farm workers are unwilling to report exposure or illness for fear of retaliation or losing their job?
I would say it's both, among many other factors. And that's something that we discuss with the community health workers when after the data analysis, we've met with the community health workers to go over our findings. And those are some of the things that the community health workers shared with us, that there may be those reasons along with other reasons for.
And then if they do, and they start a process for getting workers' compensation or disability insurance, if they got injured in the job, it's not, and we learned this in our study, their literacy level is very low. They don't speak English, or they don't read it or write it, and they are afraid that it's going to be a lengthy process. Nothing is going to really come out of it. They don't have somebody to help them. And even in instances where they did, some of the community health workers were telling us that they would make the phone calls for them, and that it would take forever to get an answer. So the process is challenging and it's hardening.
And that aligns with the feedback we saw in the farm worker health study that was reported last week. Okay. Okay, I think that we're going to go ahead and start wrapping up. And I just really want to thank you both so much for this wonderful presentation, but also this really important project, because you really centered the experiences of farm workers and their needs and their priorities and how they are experiencing work every day, and how they go about managing the symptoms and feeling, what they experience in the workplace and how they respond to it. And we need to understand that in order to know how to protect them and keep them healthy and safe. So thank you so much for your work. And I think that we have clearly demonstrated through our questions that we encourage you to continue to pursue it. Everybody had a lot of great ideas and further research questions for you to pursue. And we encourage you to apply for additional funding. So thank you so much. And thank you to everyone who joined us today. Our next seminar will be on March 6th at 4 p.m. It's the first Monday of March. And we will hear from a former PhD student from UC Davis who is also doing community engaged research with a group up in Washington State. They're going to be talking about farm worker families coping with wildfire smoke. So please join us then. Thank you, everybody. Have a wonderful rest of your day. Take care.